Now you guys can hear me and can see me. Okay, I don't know who's calling. Okay, okay, good evening, everyone. Let's continue with this class. This section was the respiratory system. So everybody can hear me now and see me?
Yeah, I can hear you and see you.
Okay, perfect. Thank you so much, Tatiana. You were helping me out there to connect all these people because they create every single class is gonna have a number, I believe. So this is
Mhm.
class number 4, day number 4, then day number 5, 6. Some people can follow the recording. I believe that was the issue.
Okay.
So yeah, we're gonna continue with this chapter, the respiratory system, because today is Thursday. So we need to kind of finish this chapter so we can start the new one and see how far we can go. Okay, so we are discussing once again prefixes, word roots, suffixes, combining vowels, combining forms from the respiratory system. So yesterday we were talking about new terms that we encounter, like ectomy, the one that we see here. So we can set tracheotomy or tracheectomy. So that will be a lot easier for us to understand when we apply them. So remember, ectomy means surgical removal and surgical removal. Oh no, this is not ectomy. This is stomy. Oh, what am I talking about here? Okay, this is tracheostomy. Remember, stomy is the suffix. Stomy means making an artificial opening. So stomy is the suffix. O is the combining vowel, and trache is the word root. So we are making a hole, let's say, let's put it away, an opening where it's not supposed to be, right here by the neck in the front of the trachea. We are making an artificial opening, like making a hole there. It's not there, but we need to go there so we can put a tube directly to the trachea so the patient can breathe through there. That's called tracheostomy. So stomy means an artificial opening making a hole right there in that area. We can make holes in a lot of structures of our body, and all of them we will call stomy. So here is tracheostomy. So that will be this term. So once again, it's not easy. We have most of these medical terms that we using. We have to memorize some of them, not all of them because it's too many. But as soon as we start using it continuously, then it's going to be a lot easier to remember these terms. So let's put together these medical terms now and try to make sense with them. It says right here, oh my goodness, this one, apnea. So if you remember that we can use the prefix an, here we're gonna use a. A is a prefix. Nia is the word root and the suffix. So it's an adjective, but let's put it this way. It is the word root and the suffix. So it is an adjective. So we're gonna put it as a suffix. So right here we can see nia means in this case, breathing. So apnea or apnea means no breathing. Remember that there are people who have problems breathing. Not they just have difficulty breathing, but they stop breathing for seconds. So they are like kind of struggle for air for some seconds. This happens most of the time at night when the patient is sleeping and they are awakened or awakened because of they cannot breathe. So this is a problem. This is serious. You can die from this. If you cannot breathe for more than 60 seconds, you can actually die during sleep. But most of the time, it wakes you up due to the problem that you cannot breathe. So these people is going to have problems sleeping. These people is going to suffer from insomnia. That's basically what it is. So A, no without what? Breathing, no breathing. That's what it means. See, here we start using A and AN. Because remember that I told you at the beginning when someone from the class asked me, where can we use A or AN? I said, let's wait until we find the word roots or whatever adjective we're going to be using, which is the combination of word root plus the suffix. And then we can find what it is the correct meaning so we can understand the terms. So apnea or apnea, once again, can be pronounced either way. It is nothing else than no breathing, no air. You're not breathing, you're not being able to breathe, to take air. So that's basically what it is. So there is a problem. Then we have below bronchitis. We mentioned bronchitis yesterday. So bronchitis is a very common medical term because it's a very common medical condition, diagnosis. The tubes that brings oxygen, or let's put it this way, air to the lungs are obstructed. They are swollen. They are inflamed. That's what is called itis. Remember, itis means inflammation. And what is inflamed? What is inflamed is itis is the suffix. Bronch is the word root. So inflammation of the bronchus or the bronchi. Bronchi is a plural. Bronchus is a singular. So if we said inflammation of the bronchus, the tube that brings air from the pharynx to the trachea to the bronchus. So it will be the tubes that branches off from the trachea to bring oxygen to bring air to the lungs. That's basically what it is. So if the lining of these tubes, the mucus, the lining, the inner layer, which is the mucous membrane, got swollen, it kind of narrows these tubes so less air is going to be able to pass through because it's very narrow for the inflammation. That's why we have problems breathing. Now we're going to have another term that is very related to the tubes that brings air to the lungs, which are called the bronchi. If it is singular, it's going to be bronchus. So here we have the bronchoscope. So we know already that scope is the instrument. It is an instrument. And what is this instrument used for? This is the suffix. This instrument is used to visualize, to look inside an opening, a hollow space. So in this case, it will be to visualize. Remember, if we have a microscope, it's an instrument that is used to visualize something that is very small. Here is a bronchoscope. Here we're using a bronchoscope because we're gonna visualize, we're gonna look inside the bronchus or the bronchi if we're using both. So plural. So that's basically what it is. We put a tube through the mouth all the way to the throat, to the trachea, through the bronchus, and then that tube contains a camera. So we can see all the trajectory of these air passage tubes that brings air to the lungs to see if there is any obstruction there. We do this test when the patient have problems breathing. We don't do this just because we want to do it. No, it gotta be a reason. Patient is supposed to be complaining about problems breathing, and we don't know what it is the problem. So we have to put the tube with the camera through your mouth all the way through the throat, through the larynx, through the trachea, then it goes to the bronchus. And then we can visualize, look, but this is an instrument that is used for that purpose. Next to it, we're gonna have bronchoscopy. We are talking about the same word root, the bronchus, the tube that brings air that enters the lungs, and scopy, remember, oops, what am I doing over there? Scopy, right here, is the suffix. And scopy means to visualize. Remember, this is the actual action. It's not the instrument. The instrument is the scope. But when we do bronchoscopy, we actually using the scope, but not mentioning the scope as the instrument. We using the process of looking, observing, seeing, visualizing the inside of the bronchus. That's basically what it is. So once again, one is the instrument, the other one is the visualization, the action that we're taking at that moment. I can have a stethoscope and have it in my hand. I say, okay, this is a stethoscope. Oh, I know what I'm using it for, to listening to the sounds. But if I'm using it at that particular moment, I'm gonna call a stethoscopy because I'm listening right now to the sounds using the stethoscope. This is the action, the function, if you will, of this instrument. So we are talking about that. Any questions with knowing the difference between the instrument and the actions, or what is the use that we give to the instrument? Remember, the use that we give to the instrument is called scopy. Scope is the actual instrument, but the instrument is not doing anything at that moment. We just see the instrument right there, but when we start using it, now it has a different name. Let me make a medical term that is not a medical term, but for you to give you an example how it works. Let's say that you have a cellular phone. If the cellular phone is not in use, it's called a cellular phone. The phone. So a phone scope. Phone scope. Let's put it that way. If you're not using it, it's a phone scope. But if you're using it, you're gonna be calling phone scopy. Why? Because now I'm utilizing, I'm using it, I'm talking to someone, I'm doing a video call, I'm doing it, I'm texting, I'm sending message through an email, I'm surfing on the net, I'm watching YouTube videos, Twitter, whatever of these social media. I'm using it. When I'm using it, it's used scopy. When I'm not using it, it's just the device right there. It's called scope. That's basically what it means right here. So don't mix these suffixes up because it doesn't work. Here we're gonna have another term. It's called dyspnea. Now we know what is apnea because we already learned. Remember apnea. So no breathing. So apnea means breathing, right? So if apnea means breathing, this is the suffix. Then this is a prefix. What is this? This means abnormal, difficult, painful. But if the patient has problems breathing, we call it difficulty breathing. The patient is having a difficulty breathing or abnormal breathing. We can say painful breathing because if you're not having pain, we cannot use it. But we can say, oh, the patient is having difficulties breathing. You know, I have problems breathing. I can't breathe normally. So that's called dyspnea. Now, if the patient says that they have pain when they try to breathe, then we can use dyspnea anyways because it means painful breathing, difficulty breathing, labor breathing. Remember, labor means that you have some type of issues there. But we're not going to use that term because that will be another medical term. But this dyspnea. The same when you go to the doctor and you tell to the doctor that you have problems when passing urine. Said, I have difficulty peeing. It burns when I'm peeing. Then you call it dysphoria. That will be the term for the problems that you have with passing urine. That's because you have an infection. You have probably a bacterial infection or viral infection. So this means abnormal, painful, or difficult. So if you have a difficult way of breathing, then we call it dyspnea. Okay, so let's move on to the next one. Endoscope. So now we know that endoscope, it has two parts. We have scope. Oh, what is this mouse? Can deal with this mouse. It's going all over. Scope. Remember, scope is the suffix. And remember, scope means instrument. Endo is the entire word is the prefix. It's not that we have a combining vowel there. No, you don't have combining vowels connecting the prefix to the suffix. We don't have it. So it is between word roots and the word root and the suffix. So in this case, endo is the whole word. This is not adding the O at the end, N and O. No, it's endo. Endoscope. What is an endoscope? This is an instrument that we're going to use to visualize something internally, to visualize something that is inside. We are looking inside something with this instrument. So endo means inside, within. So I'm using this scope to check inside something. So here we are checking bronchoscopy. So I'm using the scope to check internally where? The bronchus. But here is just a general statement. Endoscope means I'm looking at any hollow space or organ inside our body. So if I use it as an endoscope, means that this instrument is used to place it anywhere where there is a cavity that I'm going to look inside. Now, the next one. Remember, there are three things that sometimes you need to be aware of, that you're not going to make a mistake when you trying to define these medical terms. So here we have, let me make this a little larger so I can see it better. There we go. Endoscopic. So now IC is the suffix. Now endoscope. So scope is the word root. Endo is the prefix, endo. So once again, IC means pertaining to. Scope means the instrument. Endo means within, inside. So pertaining to the instrument that is used to check inside something. So it's pertaining to the instrument that is used or utilized to check something, to visualize something internally. That's basically what it is. So don't mix these terms up because endoscopy, endoscope, endoscopic sounds very similar. So I don't want you to mix them up because then you're going to have a problem. Once again, that will be very difficult. So here, endoscope, scope, and endoscopic, IC, this is the suffix. Now, endoscopy, see, scopy, that's the suffix. So endoscope, endoscopy, scopy, scope, IC, or scopic sounds very similar, but it means something different because the prefixes are different. This is scopic, this is scope, this is scopy, not scopic. So it changes. This is the instrument. This is pertaining to the instrument. This is the visualization through this instrument. So we gotta make sure that we don't mix them up, because then it's the definition that is going to be wrong. So once again, if you have your phone, remember that's scope. If you are using your phone, that is scopy. And if you are talking about your phone, then it's scopic. Oh, this phone pertains, is mine, something like that. Sorry, oops. So that's how I want you to understand. So one's the instrument, the device, the other one is I'm using it right now, scopy, and the other one is I'm talking about the instrument. Oh, this is the instrument. This has a camera. Who has a camera? This scope. That's what it's called, scopy. So once again, I'm talking about the phone, maybe the features, maybe the brand. I'm not using it. I'm not visualizing anything. I'm just talking about something that pertains to the phone. Oh, this is the case of the phone. This is the charger of the phone. So that is pertaining to. Okay, next, hypernia. Remember again, nia is the suffix, which is a combination of the word root and the suffix, and hyper, which is the prefix. So nia means breathing, air, oxygen. It means a lot of stuff. All depends on the content or the context that we find in that particular reading that we're gonna use, depending on the content we're gonna use, which is more appropriate definition. So here is hyper. We know that hyper means above normal limits. So this person is breathing too fast. To remember that we have to breathe at certain levels. For those who were in my class, we went over respiration rate. Remember that respiration rate goes from 12 to 20 respirations per minute. Respirations per minute. Now, if this person is breathing more than 20 times per minute, this person has hypernia. If this person is breathing less than 12 respirations per minute, then this person has hypopnea. Remember, hyper means more. It's like hypertension. Your blood pressure is above normal limits. If you hypotension means that your blood pressure is below normal limits. So here it is, hypopnea. Nea is the suffix. Remember, you can use as an adjective because it has the word root and the suffix attached together. And this is the prefix. Hypo means under, below, less than. And this is breathing. So breathing is below normal ranges. It's under the normal ranges. So that is how we are going to document a patient that is having problems breathing below or above normal limits. So we can say that hypernia is someone who's breathing above, more than. Hypomnia, less than, is below normal limits. So we find we can use the definition that better suits the medical term, depending of what is it that we are dealing with, what is it that we're trying to convey, we're trying to explain. That's how it works. Let's go next. See, these terms you definitely are very familiar with. Pneumonia. Remember, we talk about pneumon, pneum. So pneumonia. So this is a patient. Remember, IA is a condition of breathing, because pneumon means lungs, breathing. It is a condition of breathing. It is a condition of your lungs. When you have pneumonia, you have problems breathing. That's how you know that something is going on, because you start coughing, having all this secretion coming out from your nose. But the problem is not just in the tubes that brings the air to the lungs. The problem is within the lungs. So this is a condition of the lungs. But this is a condition also of breathing, because the lungs, the function of the lungs is breathing, taking air in and removing air. So inspiration, expiration, inhalation, exhalation. So when you have problems, usually pneumonia can be caused by bacterial infection or a viral infection. It's a serious condition if it's not treated, it can kill you. That is pneumonia. So again, pneumon is the word root. And ia is this is the word root, and this is the suffix, ia. Condition of the lungs. And what is it that the lungs do? Move air in and out of the lungs. So it can be condition of breathing. So either or, it is correct definition. Pneumothorax. Now, thorax is the suffix. Now, once again, it can be the word root because it's a part of our body. But in this case, it's used as a suffix or an adjective. We talk about that, but don't get caught up on that definition. This is the combining vowel, O, and pneumo is the word root. Thorax means chest, means air, means lungs. So in this case, means lungs. Says pneumo means air. So that means air in the lungs. But this is not normal because it's not, the air is not what it's supposed to be. The air is on outside. This alveoli is what it's supposed to be. So we need to remove this air. It's like secretions, it's like fluids inside. So for this reason, we have to do pneumosynthesis to remove the air. Remember, we can remove fluids. So here it is air that it is outside these air sacs. It's supposed to be inside the sacs, but this air is outside. This is a medical condition. Once again, you just need to know the definitions, but I'm telling you the conditions so you know that if something involves the lungs, you can say pneumo, pulmo, you can say thorax, still means the same. Once again, you have to make sure that it depends of what is it that you're talking about. You cannot use all these terms interchangeably because some of them applies, depends on the context, to the others are not. So that's basically what it is. Here we have the other term that means lungs. Remember, pulmon, pulmon, pneumon, pneumon, see, ear, here is thorax, here is ari. So ari is pertaining to the lungs. For pulmo, we cannot use air. When it says pulmo, just the word pulmo, we cannot use air. For pneumo or pneumon, we can use air, breathing. But for pulmo, no, this is pertaining to the lungs, not pertaining to the air, not pertaining to the chest. The other ones, it can be used different terms. This one is only for the lungs. But for you, so you don't get it wrong or anything like that, think that all of these terms are used only for the lungs. Pneumonia, IA, condition of the lungs. Pneumothorax, air in the lungs. Remember, this is not the normal air that goes to the lungs. This air goes outside some little structures that holds the air. This air does not go to these small sacs where the gas exchange is going to happen. The air is deposited somewhere within or outside the lungs, within all these membrane that protects the lungs. So that causes problems. That's called pneumothorax. Pulmonary, just pertaining to the lungs. Okay, moving on. pyogenic. Remember yesterday we talked about py, which is the word root, means pause. O is the combining vowel. Gen or genic, we can use the whole word. You can say gen or gen and IC. But this is a combination of a word root and a suffix. So we have lots of adjectives that we can actually use as one. I can separate them. I can put IE or IC and gen, and I can pronounce it. This is a word root. This is the suffix. But sometimes we just use genic as the suffix by itself. But we can go both ways. So this is IC pertaining to the generation of pause. Pertaining to the generation of pause. Pertaining to the production of pause. So this is an issue that happens when pus is produced inside our body. So production, this is like, it's a production generation of pus, that's it. Because pus is not a normal thing. It's not supposed to be there in our body. Pus is dead tissue, dead cells. That means that we have damage, we have infection. So pyogenic means where is this pus being generated? Where is produced? Something is produced pus. We see pus inside this cyst or this wound. Well, that's called pyogenic. Now we have the next one, very similar, pyurea. Rea is the suffix. O is the combining vowel. And pi is the word root. Because pi means pause. We know that rea means discharge. Discharge of what? Discharge of pulse. So the patient is discharging pus. We see pus coming out from some areas of the body. And remember, pus is not a normal thing. So it shouldn't be happening. It's not normal. So for that reason, we have to study a little more and see what's going on. So that's basically what it is. One is production of pus. The other one is that the pus is coming out. So you have this pus. Remember, diarrhea. Something is coming out. Some loose stools. Those are secretions. These are secretions, but not of stools. Secretions of pus. So let's say that you have a wound and you see the wound that is oozing some pus. Some pus is coming out, it's leaking. Or you open a cyst, and when you open it up, pus is contained inside this cyst, because the cyst is a hollow space that it fills with something. Can be secretions, can be blood, can be pus, can be anything. In this case, it will be pus. Here we have again thoracocentesis. Remember, centesis is the suffix. O is the combining vowel. Thorac is the word root. So this is a surgical procedure when we do a puncture through the skin through the lungs to remove some fluids. That is called thoracocentesis, because here we can say that we are perforating the lungs, thoraco, remember, because thorax or thorac means air, lungs, chest, depends of the content. So when we see the content or the context within a question or within a written information, we're going to use this content to determine what is the definition that we're going to give to the thorax. So that will be thoracocentesis. So if you see centesis as a suffix for any of these medical word roots, then you're gonna know that this is a procedure. When we do a surgical puncture, we use a needle, a syringe, it's done by a doctor, and then we remove whether it's air, pneumothorax, or we're gonna remove secretions, blood, any mucus, pus, or combination of any of those. Let's talk about these instruments that we are using to see inside the chest, to see inside the lungs. So here we have thoracoscope. Scope is the suffix. O is the combining vowel. Thorac is the word root. Do we have a combining form? Yes, because we have the word root plus the combining vowel equals combining form. We know already that scope is an instrument. What is this instrument used to? Used for checking inside the chest, checking inside the lungs. We cannot say that it's checking inside the air. How can we go inside the air? That's not possible. So we said that is to check the lungs or the chest, because thorax means that. So once again, this is a instrument, scope. All the time that you encounter these medical terms ending in scope, remember, you're going to be using an instrument all the time, your stethoscope. So your stethoscope is called scope because this is the instrument that you're going to use. So this is instrument, device, machine, if you will. Now, thoracoscopy. Remember, we always put this together because we want to make sure that you do not mix scope, scopy, and scopic. We don't have it here. But these are very important because these are more commonly used. Scopic, we don't use that except for asking you a question. But scopy is used commonly, scope and scopy. Your stethoscope, your microscope. Remember that scope means the instrument, but not every single instrument has a suffix scope. Remember that if we're going to use the instrument to check your blood sugar, it is not called scope. It's called glucometer. Meter will be an instrument. Oximeter. Oh, the instrument that measures oxygen. Here it is, the instrument to see inside the chest. This is the visualization of the chest, of the lungs. So we're doing this, the action. We are actually looking through using this thoracoscope because we check in with this instrument. Sometimes we tend to get a little confused with the terms, but that's, the complexity of using these terms, that we really need to know when to use it, how to use it. So in order for us to know that, we need to practice to use these terms continuously. Here we have thoracotomy. So here we have tomy, which is different. Here we have stomy. Here we have ectomy. See? Scopy, scope, scopic. So these terms tends to kind of throw you a little bit off. So scope, instrument, this is the process of visualization using that scope. Tomy, remember this is making an incision. Stomy, making a hole, making a new opening. But everything is surgically, meaning is done by a professional. It is required. It's not that I cut you off with a machete or with a knife and I did tomy. Or I make a hole with a bullet and then I said, oh, that's tomy. No, that is not. That is different. This is done surgically. It is to prove. It is legal. It is to it is a treatment. Ectomy. Ectomy is a surgical removal of an organ or part of an organ. If the patient has cancer in the colon, we're going to do colectomy. If he has cancer of the breast, we need to remove the breast. It's called mastectomy, because it's being removed surgically. So ectomy, it says right here, tomy, thoracotomy. So this is a incision that is made to the chest or to the lungs. We're not going to make a cut to the air, right? So air will not apply either. So we're going to make an incision, a little cut to put something through it, but it's needed. It's medically needed. Ostomy, tracheostomy. We saw this yesterday. So stomy is an artificial opening. We make a hole there to put something through it or to take something from the inside and pass it out. That is called stomy. And ectomy, once again, is a surgical removal. We can remove anything from your body that is needed to be removed, and it's called ectomy, or just make an opening, stomy, or an incision. I don't need to make a hole there. I just need to cut and put something through it or remove something through that incision. So depends on what is the need, what is the condition of the patient. We can use either or these procedures. So because surgical procedures are very common, so we're going to be using this frequently, but not you, but the medical doctors, particularly the surgical department. So that's how we are going to deal with these medical terms. Okay, any questions about these medical term parts or the definition? Okay, moving on. Remember, it's gonna take time. You're not gonna remember these right away. You might learn few of these terms. Remember, for each chapter that we cover, if you learn 10% of the chapter, that's good enough because you have some basics. So that's important. You don't have to learn it 100%. Nobody does. It took me a long time to learn all this. And because now I'm teaching it, I know it because I've been teaching it for a long time. But when I was on my workplace, I only remember the medical terms that I was using at that time. Any other term, well, it's not that I forgot, but I wasn't using it. So for that reason, I have to review it if I came across these terms, which is what you're gonna do. You're not gonna be encountering all these terms during your profession. No, you're gonna encounter some of them, and you will be familiar with those terms because you start using them continuously. That's how it works. Okay, so let's talk about these medical terms that are not built or made using the word parts. In other words, if you have the term asthma, asthma is a medical term, but we cannot divide it. You cannot come and say, okay, asthma, the suffix is ma, the word root is asthma. No, it doesn't work that way. You have to pronounce the whole thing. We cannot divide this term. It's one word. Like when you said diabetes. Diabetes is one word. You cannot split this. You cannot divide it. Here we have asthma. What is asthma? Asthma is a condition of problems with the lungs or the respiratory system because you will have problems breathing. That's asthma. Here we have another one, chest radiograph or x-rays. Chest, you cannot divide that. Radiograph, yeah, I can divide radiograph, but if I have combined it with chest radiograph, I cannot divide it. Graph is the suffix, O is the combining vowel, and rate is the word root. Yeah, I can do that. So this is a machine that records radiation on the chest, but we don't do it like that. We just says chest radiograph because this is a imaging procedure, sending you to do an imaging procedure. It's like sonogram. So most of these procedures, we don't divide them. An MRI, we don't start dividing and pronouncing the parts. No, it doesn't work that way. Here we have another one, chest computer tomography. This is what we call CAT scan. We always hear about CAT scan, but we'll not start, we don't say, okay, what is the suffix of chest? What is the suffix of computer? What is the suffix of tomography? We don't do that. We said CT scan or a CAT scan. We don't find the suffix, the prefix, the word root. We don't. We just say the whole word because these terms, we cannot divide them because it's a combination of terms. So there are some terms that we can divide, some other terms we cannot divide because they are not built from word parts. Here we have another one. Remember the CAT scan? These are radiographic imaging system that is used to have more detail of the structures that we're looking at. So chest radiograph, for instance, you use it to check the lungs, to check if you have a fracture in your bones, but you don't use it to check your brain. You use it to check if you have a fracture of your skull, but not to see inside the skull. For that matter, we use a CAT scan because it's a more specific exam. X-rays only shows broken bones. They show, once again, if we have air or any secretions within the lungs. That's it. They are not used for anything else. Why? Because it's not going to show anything. CAT scans are used for the brain, for the blood vessels, just like an MRI. So once again, that's what the doctor decides, depending on what the doctor wants to evaluate, which organ. Am I going to be able to see an X-ray? Well, if it is the lungs, if it is bones, send chest X-ray, or not X-rays. But if it's not, we send a CAT scan or an MRI or a sonogram. So each one of these imaging systems, they can show certain structures of our body. So that will be a lot easier to look at it, like tissues, like blood vessels, like blood flow, whether it's outside, whether it's inside, whether there are bones. So once again, that's how it works. Let's talk about COPD. COPD stands for chronic obstructive pulmonary disease. We cannot divide this. Oh, chronic, IC and Crohn. Well, IC, well, I know what it means, but what is Crohn? Doesn't exist. Obstructive, how can I divide obstructive? Number one, obstructive is English. Chronic is English. The only one here is pulmonary. Disease is English. So what am I going to divide pulmonary? There is no need. I just said chronic obstructive pulmonary disease. This is a condition that happens to smokers, people who smoke frequently and a lot. A lot means 1 package, 2 package, 3 package per day. These people is going to develop this condition. These are the people that is continuously coughing and throwing kind of phlegm outside. All the time coughing. And this cough is like with rhonchi. It's like when they cough, you hear like gurgling, like some water. The cough is not a normal cough. So that is called COPD. They have damage inside the lungs already. And the tubes that brings the air inside. So here it is another term, emphysema. We don't divide it. We don't say emphy and ema. No, it doesn't work that way. We don't divide it. We just said emphysema, period. This is collection of secretions, mucous secretions inside the lungs. So when you have chronic bronchitis plus emphysema, you develop COPD. So you have chronic bronchitis, which is inflammation of the bronchi, the tubes that brings air to the lungs, plus these secretions, so lots of secretions, mucus, this phlegm that sometimes is greenish or yellowish. So then you have a combination of two, then you have COPD. You can have chronic only bronchitis. But emphysema mostly is a damage to the lungs, and it is irreversible, meaning you have it, you damage it, that's it. There is no cure for that. The only treatment is prevention. What is prevention? Do not smoke. If you are exposed to fumes, chemicals, like working in a coal mine or gold mine, then for a long periods of time, you can develop COPD as well, maybe cancer of the lungs. Okay, another term that is frequently used, the flu. You hear about all the time, and we actually get the flu, probably several times per year. This is a viral infection, very common. It is called influenza. But because the name is so long, we just said flu. We just use this little part, flu. So whenever somebody says you have the flu, well, when we record this in the medical records to bill for your conditions, to be reimbursed for the services provided, then we call it influenza. We don't write the flu. Flu is a layman term, if you will. So this is a viral infection, the flu. And influenza, we don't divide it. Let's go to the next one. Sputum. What is a sputum? Sputum is this mucus, these secretions, this flame that comes from the lungs. Sputum is not something that is produced in the throat or in the nose. No, it has to be from the lungs. So we do a test that is called the sputum test. So we collect that when we suspect that you might have TB. What is TB? Tuberculosis. So we need to collect your sputum because your sputum comes from your lungs, and tuberculosis is a bacterial infection that if it happens to you, it will be inside the lungs. Tuberculosis is very dangerous. It is contagious. It kills. If it's not treated or not treated correctly, it can kill you. These are the patients that are going to be in isolation. These are the patients that you need to use a respirator when you go to the room. You need to put all these personal protective equipment. Respirator is something that has to be adapted to your face. Sometimes we use mask N95 because this is an airborne condition, meaning that is transmitted through the air when the patient coughs. If you use utensils that this patient uses and it has saliva within, and you use it without cleaning them, you're gonna get tuberculosis. If they cough, you are next to them, you're probably gonna get tuberculosis. So it's very contagious and it's dangerous. It can kill you. Remember, people get vaccinated for tuberculosis, and it is important that you understand this term because you will be asked on national certification. Tuberculosis, you get tested as a medical assistant. You get tested at least once a year. Some of the hospitals test you every 6 months. if you travel out the country to tropical countries where tuberculosis is very prevalent, meaning that these cases occurs more often, then you probably were exposed to tuberculosis. They're gonna do the TB test. Remember, this is the little needle that they insert right here on your forearm, in front of your arm, and leave a little bubble right there. And then you have to come back within 72 hours to be read. That's the TB test. So once again, very common. Know about tuberculosis, know about the TB test. Remember, TB means tuberculosis. Here we have another term that we use a lot. URI. U, upper, R, respiratory, I, infection. Be careful, don't mix them up with the infection that it is inferior, not superior, not upper, lower respiratory infection. So once again, this is URI. If you have problems with your nose, with your throat, with your larynx, that is called URI. If you have problems with your trachea, your lungs, your bronchioles, that's a lower respiratory infection. So the respiratory structures are divided into two, as I mentioned at the beginning of this chapter. Anything above the larynx, the throat, or the pharynx, the nose, that is upper respiratory infection. Below the trachea to the lungs is called lower respiratory infection. So know these abbreviations because they are come very handy. Now, do not mix this up either with UTI. This is something different. UTI. Urinary tract infection. This is not urinary. This is upper respiratory infection. Because they ask about UTI as well. Remember, UTI is a urinary tract infection. URI, upper respiratory. Totally different. Two different systems, two different conditions. They are not related. So it's just that this abbreviation, not abbreviation, these acronyms look very similar. Okay, so let's see these pre-test questions and see how you do. Oh no, let's talk about these abbreviations. I was right. These next abbreviations. So let's go over the first one. CT, CAT scan. Remember, this means, we order a CT to the patient. Do a referral to this patient to get a CT. It is a CAT scan, remember, or a computerized tomography. But we use all the time CAT scan. The doctor is not going to say, oh, do a computer tomography. No, it says, send this patient to get a CAT scan of the brain, a CAT scan of the stomach, a CAT scan of the arteries, something that they want to see. An abdominal CAT scan. Okay, fine. But you know what is it? Because you have to select in that particular form that you're ordering, that you're sending, you have to send. Sometimes the doctor give you all that information, but you need to know you need to do the referral. So when you see CAT scan or CT scan, you know there's CAT scan. We know what is COPD, chronic obstructive pulmonary disease. CXR, chest X-rays. Flu, influenza, we have it before. Remember, you can go back and read the full spelling. TB, tuberculosis. URI is upper respiratory infection. We are not using here UTI because this is not the urinary system. When we get to the urinary system, we're going to see UTI. Here is the respiratory system. The instruments that we use to check the respiratory system, condition the respiratory system, another imaging report that we use for checking the lungs, chest X-rays. This is a condition of problems with breathing, which is the flu. This is a condition of the lungs, a bacterial infection that is called tuberculosis. And this is a condition of the upper structures of the respiratory system, URI, upper respiratory infection. Remember, in the previous slide, I have described the meaning of each one of these terms, these acronyms. So you don't need to go and check on your computer or you Google this, nothing. You just go there and make sure that you just review the slides. I don't want you to get confused going and trying to figure it out because CT might give you tons of definitions that mean something else, but this is the medical. And this is an imaging report for the or instrument. So for that reason, I want you to focus only on the medical part. Okay, pretest, inflammation of the larynx. Let's see who get it right. A, B, C. I'm gonna use the chat again, the chat, so you can send me your answers. Let's check it out. Okay. All right. So give you a few seconds more for you to try to figure it out. Remember, once again, things that you need to know to find the right answer. Count the number of terms that is used in each one of these terms. So here you have the same number because you have iris, has iris, and you have iris. But look at this, larynx, this is a given. This is the only one that has this. Everything else, the bronchi and the pharynx. So the correct answer should be C. Oh, I'm sorry.
Okay.
Somebody's asking me a question.
No, I was telling you, I was trying to write it in the chat, but for some reason it's not sending. I don't know if everybody's having the same problem.
Yeah, just are you using the chat, right? There's a little icon all the way up on the upper left side of your window, and it says chat right there.
Okay, I see it.
There you go. So you click in there, and when you want to ask something or say something, if you don't want to say it, through the microphone, you can just type something in there or give me just the letter of the answers from there, okay? Good. So the correct answer is letter C, remember, because this is given, it's given right here, larynx. Inflammation, iris, these have iris, these have iris. but this says inflammation of the pharynx. They're not asking me the pharynx. They're not asking me the bronchi. They're asking me the larynx. Good. Let's move to the next one. Second, infection of the nasal cavity, pharynx, or larynx. Remember, infection of the nasal cavity, pharynx, or larynx. Then let's see which one is the right answer, A, B, or C. Going good? Anybody else? Excellent. Yes, I'm agreed. That is the correct answer, A, because this says asthma has nothing to do with that. Emphysema, this is secretion. It says infection, upper respiratory infection. Here you have the key. Now, what I'm trying to tell you is that when you read the questions, within the questions, you have the answer. Right here is infection, infection. The previous one, it says larynx. So don't get like kind of discouraged, if you will, saying, oh, no, it said something like that. It's just to throw me off. No. Most of the time, I might say that 60% of the time, the question have the answer. So if you don't read the question carefully, you're going to miss the answer. Because remember, most of the questions, you have the answer right there. Difficult breathing. A, B, or C? Okay, anyone else? Okay, so we're talking about here the prefix. So here the key is this, because all of them have breathing, see? Nia, Nia, Nia. So we just need to know hyper means you breathe in too fast. Hypo, you breathe in too slow. Okay, what is left? So try to figure it out first, the one that you know that do not apply. And whatever is left, probably chances are that you have 50% or 75% chances of getting it right. Difficult, abnormal, painful breathing, this. Remember, Nia means breathing, means air. Good. Guys doing very well. So make sure that, you keep on reviewing these terms. Next, discharge from the nose. Be careful, that is discharge. That is the key. A, B, or C. Very good. Okay, you're getting this. You're getting the hang of it. Okay, so I'm gonna solve it. Remember, discharge, nose. All of them has nose. Rhino, rhino, rhine. This is inflammation, iris. This is liquid. Discharge, remember, it's mostly like blood. Think about hemorrhage. Rhea, this is discharge from the nose. Rhea is discharge. Like, once again, diarrhea, gonorrhea. See, those are discharge from different structures, of course. But this is from the nose. So most of the time, questions for a national exam, they usually change the word root. So they don't try to kind of trick you, saying rhino, 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 this. No, they usually change the word root as well. They might use the same suffix, and one of them is different, just like we did before. Excellent. Really good. So you guys getting in there. And once again, read it, evaluate it, because that's going to be your final exam. Number 5, visual examination of the larynx. Be careful right here because it says visual examination. So that's what you're going to look for. Remember that these terms usually are very tricky. You need to mix them up. A, B, or C. Let's see how we're doing. Okay. Anyone else? Few seconds more to see who else give us an answer. Otherwise, we're gonna go and just go over. So all of them has larynx, so this should not be a given because larynx, larynx, larynx. So the key is scopic, scope, scopy. Remember, this is pertaining to the scope. This is the scope, the instrument. This is pertaining to the instrument. This is the instrument. So scopy will be the visual examination of the larynx. Excellent. Very good. Very glad to hear, to see that you guys are getting this because once again, these are medical terms. This is a different language. So okay, before we move to the next chapter, any questions about this chapter? Okay. Let me change this. Okay. Oops. Oh my goodness, what's going on with this? Nautilus. Okay, so next chapter, lesson number 5, or chapter number 5, the musculoskeletal system. So let's get moving on with this chapter, and then I'll give you a break. Then we continue. Probably we finish this chapter tonight. So if we talk about the musculoskeletal system, we are talking about here the muscles, see, and the bones, skeletal. Because muscles are attached to the bones. So usually we use them together. It's like cardiovascular because we use the heart and the blood vessels that are attached to it. So this is the musculoskeletal system. We're gonna talk about these word roots, these suffixes, but most importantly, the word roots that we're gonna use from the muscle system, or the muscular system and the skeletal system. Okay, so moving on. Here we have the musculoskeletal system. Here only we see the skeleton, of course. We are not going to talk about every single bone. We are going to talk about the word roots used for bone, cartilage, probably the bone marrow, some of very particular bones like the hip bones, the ribs, the bones that makes up the skull, maybe the bones that makes up the upper or lower extremities, and some of the muscles. This will be discussed in anatomy and physiology. If you have not taken anatomy and physiology, then you will be seeing it. I believe anatomy and physiology is next if you have not taken, otherwise it's another chapter. I don't know where exactly we are. Okay, so let's talk about the functions of the musculoskeletal system. So one of the main parts of the musculoskeletal system is that it serves as the framework. Can you imagine without the bones, how can we stand erect? How can we sit? How can we move? You wouldn't be able, right? Only muscle, only mass. We didn't have like no real form, structure. So that's the first one. Support. Well, the skeletal system supports the muscles, supports and protects organs that are internally. It helps us with movement. If you didn't have bones, you wouldn't be able to move. If you didn't have muscles attached to the bones, you wouldn't be able to move either. So it's very important for us to make sure that we do understand the function of all these systems. Protects internal organs. I already mentioned it. Muscles and bones, they protect internal organs. The skull protects the brain. The rib cage, they protect the chest organs, heart, blood vessels, lungs. The hip bones, they protect all these reproductive and urinary structures. One more function, stores calcium. Bones stores calcium. Bones do not produce calcium. They store it. It's a storage for calcium. And if we don't have enough calcium, that is going to be distributed to the bones and any other structures that need that for the proper functioning, then the bones are going to become very weak and they're going to break. They're going to bend. They're going to cause us problems. Last but not least, blood. All the blood cells, blood in general, is produced within the bones. Red blood cells, white blood cells are produced in the bone marrow of the long bones. So think about it, not having a healthy bone, not having bones, then where are we going to get the red blood cells, white blood cells, and platelets? That will be very hard, right? So when we have diseases that affect our bones, then we're going to pay the consequences because we're going to have problems producing blood cells. And if we don't have blood cells, figure it out. Red blood cells transports oxygen and removes carbon dioxide. So if we don't have something that is going to transport oxygen, we're not going to be able to survive. White blood cells protect us from all these infections. Is the defense mechanism. And now if we don't have enough or we don't have white blood cells, we're going to be exposed to an infection. The flu can kill us. A mosquito bite can kill us. So very important. If the bone marrow is damaged, then we don't have platelets, thrombocytes. These are the cells from the blood that prevents bleeding inside, internal bleeding. So with a simple procedure like drawing blood, we will have a problem because blood will not clot. If it's not clotting, then we're going to be bleeding and bleeding and bleeding. So all these functions are very important. Remember, muscles as well as bones protects the internal organs. They do a lot of stuff that benefits our body. So it's a good thing to keep them healthy, in good shape. Other than that, we're gonna develop medical conditions. Okay, so let's talk about some of the word roots from the musculoskeletal system. Most of the ones that I see here sounds like bone parts, bone roots. So let's begin with artery. Artery comes from joints. This is a word root, remember. It's a joint. That's what we said, arthritis, inflammation of the joints. Bursa. Bursa comes from bursa. Bursa is a membrane that it is contained within the joints. This is one bone. This is another bone that connects to it. So let's say this is this. This is another bone that connects right here. So right here we have a membrane that contains some fluids. And this fluid acts as a cushion. So when this bone is moving, the bones do not have a friction between themselves. They do not collide. You have like a cushioning in between. This is like putting a pillow in between the bones. Otherwise, we will have problems when we walk or when we do something with the hands, with the arms, like the elbows, like the knees, like the wrist, like the shoulders, like the hips. We have bursa there. It is a membrane that contains fluid. And the fluid is called the synovial fluid. For now, we're just talking about, once again, the structure, bursa. It's not commonly used. You're not kind of talking about bursa all the time, but yes, you're going to be talking about arthritis a lot because people come to your office complaining about knee pain, back pain, shoulder pain, elbow pain, hip pain. If you have problem with the joints, chances are you have arthritis. Carp, these are the fingers of the carpal fingers. So once again, these are fingers of the hand, the bones of the hand. These are fingers. These are bones from the hand. Carpals, metacarpals, and fingers. So this will be the wrist bones. So if we see a picture of the bones of the hand, then we will see that those bones that makes up the wrist will be the carpals. So carp is the word root from carpals. You heard about the carpal tunnel syndrome, probably. Well, it comes from carpal, this particular bones from the wrist. Here we have another term we have already discussed, condor. Condor is chondrome. These are cartilage. Cartilage. Here we have pose. Remember the cartilage, going back to this, is the soft structure. Well, not too soft, but it's softer than the bones, that it is on top of the bones at the intersection of the bones. So if you have a bone, right here on top, it has cartilage. Right here on the bottom, it have cartilage. If I have another bone, it has cartilage and it connects with them. This cartilage plus the bursa and the liquid inside, the synovial fluid, these are what this works as a cushioning, remember. And don't allow this bone to have direct contact with the bone that is right here. When this disappears, then you have arthritis. When this gets damaged, then you have arthritis. See how important it is? The cartilage, the bursa. Okay, we have here cost. Cost is not the English word for price. It's not. Cost comes from costo, Latin for costilla. Costilla means ribs. These are the ribs. Costo. Here we have something that is a lot easier for you, crani or cranial. The cranium, the bone, the skull. This is the bone that protects the brain. Femur. Femur is the longest bone of our body. Usually is written as femur. You are. This is the longest bone of our body. And where is this bone located? On the upper leg, the thigh. The thigh. So that will be the femur or femur. Iliac. Iliac comes from iliac or ilium. These are the bones of the hips that looks like ears. See, they are attached together. These are the hips. These are the bone hips. Ilium. Gonna see later on, I think that I have an image with the bones of the hips. So then we're gonna be able to show them. Remember, very important to know the femur, because it is the longest bone of our body. And it is on the lower extremities, the upper leg, or the thigh. Thigh means spinal vertebrae, or the spinal vertebrae. The column, the spinal column. When we have all these vertebrae on the back, that's called kyph. Later on, we're going to talk about the name, why it received this name. This usually is the part of the vertebrae that are on the thorax, so on the shoulders. Then we're going to talk about Lord. There is nothing religious about this one, so be careful. Lord, this is part of the spinal cord, but this is the lumbar part. So we're gonna find some conditions that happens to the shoulder vertebrae or the chest vertebrae on the back, the abdominal vertebrae or the lumbar vertebrae on the back. So we will discuss that. Necker or necro, this means dead tissue. Remember, necrosis, necrosis, dead tissue. Very important to know that necrosis. Oste, very easy. Oste is bone. Osteo comes from bone. Later on, we have a complete medical terms with the suffix, and then we're going to understand a little more certain definitions about this word root. The phalanx means fingers. These are the bones of the fingers. Remember, when we look at our fingers, they can bend in certain areas. And we have this distal part, middle part, and the proximal part. They have different little bones right there, but those are called the phalanges. So phalanges, finger bones. Little by little, once again, you will kind of remember, learn these terms, because you can't have all these terms at once. You're gonna be little by little learning, and the ones that will stick with you are the ones that you are continuously using. If you don't use this at all, then forget it. You're gonna forget most of them. And it's no problem, because you're not using it. Where are you gonna remember those? Okay, more word roots, prefixes and suffixes. But we have more than whatever we have here when we start going over these complete medical terms. Pube, it's not pop, it's pube. For the pubic bone, pubic bones. These are the bones on the hips. we have another bone, another term that you're not familiar with, rachis. Rachis means spinal cord or spinal column, depends on what is the context all about. So most of the time is the spinal cord. Scoli, you might say, oh, well, wait a minute. Scoli doesn't sound like anything that I know. Yes, you do. You heard about the word scoliosis. Well, this is what it is. Scoliosis is a medical condition, an abnormal condition, an abnormal curvature of the spine, the entire spine. So we have some images right here that we're going to go over those so you can understand what is kyphosis, what is lordosis, what is scoliosis, because these are abnormal curvatures of the spine. This is another one that means spine or spinal cord or the spinal column, spondyle, spondyle. Now, if you need to remember something from here, it's going to be scoliosis. Anything else, not so common. And most of the time, these terms, you're not going to be using it much because the patient is not going to say, oh, I have problems with my spondyle. No, I have problem with my back. I have back pain. And then the doctor is going to evaluate, it's going to say what exactly you have. But those are, without offense, none of our business. Whatever the doctor diagnosed the patient with, have nothing to do with that. If I don't know the term, I'm not worried because these are medical diagnoses. And we don't get involved if the patient asks, what is it that I have? Oh, you need to discuss that with the doctor. Oh, the doctor told me, but I just don't recall what it was. Okay, give me a second. Let me go talk to the doctor. And you go talk to the doctor and you tell that your patient doesn't understand what the diagnosis was. And she needs to know. You don't reassure the patient about what they have. You bring them back to the doctor because this is the doctor's job, not yours. So you don't try to explain, you don't try to figure it out. No, easy. Give me a second, Mrs. Rodriguez. Let me go to talk to the doctor. And you tell the doctor, oh, I have Mrs. Rodriguez or Mr. Rodriguez. You just evaluated him or her. And she's a little confused about the diagnosis that you told her. Do you want to talk to her again or what do you want to do? Sure, not a problem. Bring her here. No, I'm going to meet with her. That's it. That's your job. No worries about explaining something that you don't know. Something that doesn't pertain to you to do. That's it. Simple. You didn't do what the patient was asking you to do, but you got the assistant. You went to the doctor. Stern. Stern. This comes from sternum. This is the chest bone, the breastbone. Sternum. Breast or chest bone. This bone right here, where the ribs attached to in the front. 10 has nothing to do with number 10, of course not. This has to do with tendons. Tendon also. 10 and tendon is talking about tendons. The tendons are these structures. Tendons are structures that connects muscle to bones. Very careful, because we have something else that are called ligaments. The ligaments connects bone to bone. So when we get to anatomy and physiology, if you have not taken it, I will go over all these structures because these are very common questions for exams. What is a tendon? What is a ligament? So you need to understand that. Vertebrate, this comes from vertebrae. Remember, vertebrate, the spinal column. Each one of the pieces that makes up the spinal column, each one of them is called a vertebrae. That's it. So at least you have an idea. What is it that we're talking about? I'm not expecting you once again to recall, to know, to learn all this information. No. It takes time, practice for you to know all this. So don't kill yourself trying to memorize any of this. Let's talk about these prefixes and suffixes, and we're gonna go and take a break. Okay, prefix, inter. We talk about inter. Inter means, oh, probably not, in between, inter. Remember, I said last time, a very common term, international. You are in between countries. International. So we're gonna have different terms right here. Intervertebrate, something that is between the vertebrae. So we will find some other terms where we're gonna use inter. Suffix. This is fixation. Oh, you are fixing something. Yeah, not that you're gonna fix something like repair it. Well, in a way, yes, but this is like fusing something. Fixation means to put something that you used to move, now they fix. They are not moving anymore. So you have a fracture, or you have a problems with your knee or your shoulder. Now we're gonna fix this right here. You're not gonna be able to move your elbow. You're gonna have your hand straight. We're gonna fuse that. That's fixation. This is. You're gonna fix it. You're gonna place it there so it doesn't move. Why? Because these internal structures are damaged. We need to remove them, but then you're not gonna be able to move your arm. If we remove this kind of cushioning in between, well, you're gonna have a lot of pain whenever you move your arm. Well, we stabilize it. We don't allow it to move. We fix it, we fuse it. That's what we're talking about. Malaysia, remember these are suffixes. It means softening. Something becomes very soft. It's not supposed to be soft. Bonds are supposed to be very strong because they are the one that supports the weight of our body. So if they become soft, what is it that they're going to happen to them? They're not going to break. They're going to bend. So if you have someone, have you seen people who has the legs like bow legs? Like this. It looks like a, what is called, I forgot the name. Forget stuff. Like these guys who ride horses. What is called? I just forget the name. So then, you see, the legs are supposed to be like this. Not bow legs. So if you have bow legs, you have a condition with softening of your bones.
Professor, you mean like cowboys?
Oh, that's the word. When you were going to say it, I was about, oh, thank you. Yes. Like a cowboy without the horse, right? They're walking like that with the bow legs. And you've seen little kids also with bow legs because they lack calcium. So they have problems with the formation of the bones. The bones becomes kind of soft. They don't break, they bend. So that's Malaysia. So that is a very good sample because the bones becomes soft, but also the cartilage in between the joints, it becomes like jelly. It's not supposed to be like jelly. If they become like jelly, then it's kind of liquefies in between the knees or other bones. So this is not going to be good because these bones are going to be colliding in between each other. And that's when you have the pain. That's when you develop arthritis. Thank you. That was the correct answer. Okay, so let's go on break because right now I believe it's 7. Oh, 7 o'clock. Oh, this is great. So we come back at 7:25. Okay. If we take until 7:30, that's not a problem, but 7:25 should be the time to return to the class. Got it? Okay. So see you then.
All right.
7:25 to 7:30. Let's put it 7:25, but if you get a little caught up doing something, 7:30 is just fine. Got it? See you then. Enjoy. Okay. So we are back.
Hi.
Hello.
Teacher.
Yeah. Okay, so I hope you guys enjoy your break. Today I'm giving you a break that you can use it to eat something because at this time we come hungry, right? I just have my fruit and that's it. And later on, probably eat something else. Something soft, of course, otherwise I'm not gonna be able to sleep. Okay, so let's continue with this chapter, the musculoskeletal system. We're almost done with this chapter. So let's go and see these procedures when we can use these medical terms. So let's talk about first arthroscope. Remember, scope, this is the suffix. O is the combining vowel. And arthur is the word root. So if you have word root and combining vowel, we have a combining form. Scope is the instrument. Arthur is the joint. So we're gonna use an scope instrument to visualize the articulations. So we use an instrument right here that is gonna go inside the knee, and we're gonna see what's going on right here in this space, where is the cartilage and the bursa. Remember, we visualize this because we have on a screen right here, and this is a camera that goes inside, and we're checking what's going on over there inside the joint. That's what we do. That is the scope, the instrument. Now, arthroscopic. Arthroscopy, scopic. So scopic means pertaining to an instrument that is used to check inside the articulation, the joint. That's basically what it is. Now it is here. We said Arthur, oops. I crossed it out instead of, I thought it was a highlighter. Let's see. Oh yeah, this is a highlighter. I thought it was a highlighter, but it wasn't. So right here, Arthur, which is the joint or the articulation, all the combining vowel, scope, which is the instrument. This is the instrument that we're using here. Then we have Arthur, which is the joint again, all the combining vowel, and scopic, pertaining to visualization of. So this is the instrument that is used to visualize this. So that will be the instrument. This is pertaining to the instrument. Now we're going to see this one right here, arthroscopy. Scopy is the suffix, O is the combining vowel, arthur is the word root. Remember, scopy now is the actual action of visualizing. So visual examination of what? Of the joint. Viewing of the joint. So this is how we use these terms. So it's not complicated. These are procedures done by medical doctors, particularly the medical doctors that specializes in the musculoskeletal system, which are orthopedics doctors. This is not any regular doctor. This is not probably a surgical doctor can do it, but a surgical doctor that is in orthopedics, which is the doctor specializes in bones and muscles. So that's basically what these terms are all about. Remember, Scope, the instrument. Scopic, this is pertaining to the instrument used to visualize. Scopy is the actual visualization or the examination that we're doing at that particular moment. So if we use these terms in this way, it's going to be a lot easier for us to understand how to utilize these medical terms, where to use them, how to define them. Okay, so let's talk about these medical terms of the medical terms that describes articulation of bones, the skeletal system, and the musculoskeletal system. Arthralgia. Well, we know that arter is the word root. So whatever is left is the suffix, algia. Algia means pain. Pain. So pain where? In the joint. Joint pain. So when someone has pain in the joints, we call it arthralgia. Then we have arthritis. We know itis because we learned it already. Itis is the suffix, means inflammation. Arter means, once again, joint. This is inflammation of a joint. So as we walk through all these terms, because we are repeating most of the suffixes, the word roots, and probably the prefixes, we're gonna able to kind of learn this a little more. We kind of, remembering this better. Let's talk about arthrogram. Now this is a new term. So we're gonna kind of introduce here two new terms. Gram, which is the suffix, O, which is the combining vowel, and arter, which is the word root. What is gram? Gram means recording. It's like the printout. We are recording what? The articulation, the joints. Remember when we learned electrocardiogram? Gram is the recording of the electrical impulses of the heart. Here, we are capturing an image of the joint. That is gram. This is recording the image of the joint because we're seeing it on a ultrasound, on a sonogram or ultrasound. Have a camera there that we introduce into the joint, and we seeing it, we are visualizing it. But now we're gonna print it out. We're gonna record it, and we're gonna see what is it. That is arthroplasty. This is another new term. Remember, gram, it is recording. It's like printing out something that we see. It's like showing you a picture of what is inside the joint. Plastic. You heard about plastic. Think about plastic surgery. That's plastic. So plastic is the suffix. O is the combining vowel. Arter is the word root. So this is plastic or surgical repair. Remember, when you have plastic surgery, what is it that they're doing? They're reconstructing something. They are fixing something that doesn't look good or is not functioning correctly or just doesn't look good. So we are surgically repairing. What are we repairing surgically? The joints. If you have rhinoplasty, see, rhino means nose. So rhino means nose, but it's a said plasty, so that is surgical repair of the nose. So anything that we repair is called plastic. So anytime that you see plastic as a suffix, you know already that this is a surgical repair. Think about plastic surgery, because you see plastic at the end. So arthroplasty is surgical repair, surgical reconstruction of the joint. We're going to use here again the instrument that we're going to use, scope, suffix, o, combining vowel, arter is the word root. Scope is the instrument. This is the instrument that we're going to use to visualize inside the joint. Here we have arthroscopy. Scopy is the suffix. O is the combining vowel. And arter is the word root. Now, what is scopy? The scopy is the actual visualization. We're going to visualize the joint. This is a visual examination of the articulation or the joint. See, when we see this many times, start kind of sinking in our brain. But if we don't use it for quite some time, this is going to go away. So once again, if we use it, fine. If we don't use it, it's just gonna disappear. But later on, if you kind of get exposed to these terms, then it is not difficult for you to learn it, because you're gonna go back, you're gonna revisit, oh yeah, I remember this one. I didn't have it right here on the tip of the tongue, but then I went over my notes, I Googled it, and I said, oh yeah, that's what it means. So for now, we just kind of, follow along and make it easy for you. Carpal, remember carp, AL is the suffix. Carp are the bones of the wrist. This is the word root, carpal. Remember that we have the carpal tunnel syndrome, which is a little problem with some of the ligaments, that passes through this space in between the wrist and the bones from the lower arm. So again, that's a condition. Probably we have it a little farther up. I don't know if it's there, but that's what it is. So carpal, remember, these are the bones of the wrist. The first bones that connects to the long bones of the hand. Of the arm, I'm sorry. Chondrectomy. Ectomy is the suffix. Now here, we're not gonna have the O, chondro. Why? Because the suffix starts with a vowel, E. So we don't need another vowel. Condor is the word root. Condor means cartilage. Remember, this is the structure that are between the bones or on top of the bones, because it's going to connect with another bone. And this is going to protect the bones, so we don't expose the bone against the bone. We have something in between, like a cushion, to prevent friction and damage and pain. So this is the removal, surgical removal of cartilage. Yes, we can remove cartilage that is damaged, maybe chondromalacia, maybe you have arthritis, there is nothing there, no cartilage left. We remove whatever piece is there and we replace it with some artificial cartilage, some synthetic cartilage. Depends on the part of the body, we might just fuse those. So you're not going to be able to move that articulation because there is no treatment for it. So ectomy means surgical removal. And what is it that we are removing here? The cartilage. Chondritis. Itis, we know already, this is the suffix, means inflammation. Chonder is the word root that means cartilage. So inflammation of cartilage. What do you mean inflammation of the bone, inflammation of the cartilage? I thought that was solid, no, inflammation means that it just causes pain because it becomes very weak, becomes very soft. So now it's painful because it has nerves, it has blood vessels through it. This is a live tissue. Bone, even though if it is the stronger structure of our body, we have bone pain because it has nerves in between. This is like toothache. So it has nerves, it has blood vessels. It's a living structure. For that reason, it hurts. Bones are not dead. Cartilage is not dead. As long as we are alive, these structures have blood flow, nerves going through it. And they have nutrients, they have all these electrolytes being absorbed. Remember, the bones produces calcium or stores calcium. So these are real structures, life structures, living structures. So they also hurt and they swallow. That's what sometimes our knees hurts, not just because we don't have the cartilage. You can have it, but it is damaged. It's very soft. Or it is waste. That's basically what it is. So chondro, once again, is cartilage. Any questions about these medical terms? Okay. Let's continue with medical terms. Cosectomy. See, cosectomy. Ectomy is the suffix. Cos is the word root. What is ectomy? Surgical removal. Surgical removal of what? Cos means ribs. So this is the surgical removal of all the ribs. Oh, I'm sorry, the ribs, not the wrist. Ribs. So we can remove the ribs if they are damaged. They are broken. They are causing damage to the soft tissue surrounding the ribs. If it cannot be repaired, has to be removed. Now, is this happening all the time? No, this is just medical terms. We're just using any part of the body and combining it with the suffix or with the prefix just to form medical terms. Maybe some of these things don't happen or don't happen often, but we just building medical terms with its parts. That's basically what it is. Cranial, we know that AL means is the suffix pertaining to. Crani is the word root pertaining to the cranium, pertaining to this bony structure that protects the brain. That's what it is. Cranium, pertaining to something that we're talking about the cranium. Maybe the frontal lobe, maybe the occipital lobe, maybe the parietal lobes. We're talking about anything about the structures of the cranium. Craniotomy. Remember, very careful when you read these terms because it's stomy. There is no ectomy, there is no stomy. Tomy is the suffix. O is the combining vowel, and crani is the word root. Tomy is an incision, an incision cutting through something. Incision to the cranium. Oh, do we do incisions to the cranium? Of course. If you have damage to the cranium due to a car accident, due to we need to operate your brain, we need to cut through and then close it after. So that's called a craniotomy. Remember, craniotomy, we do a incision to the cranium. We cut through. Then we have intercostal. Now, if you remember, for those who took EKG, certain electrodes are going to be placed in between the ribs. So that's called intercostal. AL pertaining to is the suffix. Cost is the word root. Inter is the prefix. Pertaining to, remember, inter in between, cos ribs. Pertaining to in between the ribs. We have the intercostal space. Remember when we were placing those electrodes? Intercostal space number 4, which is mid-clavicular intercostal space, 4 intercostal space, 5th intercostal space, 6th intercostal space. So once again, it's very important because these terms we can use it in certain procedures that you as a medical assistant are going to perform. So very important. So that will be intercostal. Here it said osteoarthritis. Next one. I'm gonna break it down. Itis is the suffix. Arthur is the word root. O is the combining vowel. Oste is the word root. So itis is inflammation. Arthur is the joint or articulation. Oste is the bone. So this is inflammation of the bone and the articulation, or the articulations in between the bones. So you can use either or. So whichever sounds better for you. Once again, it might be articulation, inflammation of the articulations in between the bones. Because remember, two bones, when they meet, we have an articulation, like the elbows, like the wrist, like the fingers, like the ankles, like the knee, like the hips, shoulders, like the spaces in between the vertebrae. So those are articulations, joints. So it is important to know where the joints are. Joints, as the word implies, two things are meeting in that place. So that's a joint. So inflammation to these articulations in between the bones is called osteoarthritis. Osteoarthritis is a type of arthritis. Remember, we have different types of arthritis. Arthritis is just, oh, I'm sorry. Arthritis is just a general type of inflammation of the joints. But we can have osteoarthritis, We can have rheumatoid arthritis. You can have infectious arthritis. You can have gouty arthritis. So there are different types of arthritis depending of which structures are the ones that are damaged in between the joints. So osteoarthritis, the bone is damaged, not just the cartilage. The bone is damaged. So it's a very serious condition. Arthritis is a serious condition. It doesn't matter which one you have. Why? Because there are problems with the articulations, and we are not able to move normally, or probably not to move at all. Very painful when you walk, when you do certain movements. So people stops doing it, moving. Osteomalacia. Malacia is the suffix. O is the combining vowel. Osteo is the word root. Malacia means softening. Remember, something becomes very soft. Osteo, bone, it is softening of the bones. Remember, we talk about the cowboy legs, right? Like bow legs. Or the little kids. But for the little kids, it changes a little bit. So the condition is malacia, but it goes a little beyond that because it's a lack of calcium that causes for these guys, they are adults. So that is just the bones that becomes very weak, soft. And instead of breaking, they bend. Okay. So when you see someone with bow legs, that's not normal. Now, once again, we're not gonna bull them. We're not gonna start picking on them or anything like that. It's just that it's a condition. Remember, just like any other condition. Osteopathy. Pathy is the suffix, means disease. O is the combining vowel. Oste is the word root that means bone. This is a disease of a bone disease. So certain medical terms we can use the word root first and pronounce it. Bone disease is correct. All disease of the bone is also correct. But for some terms, you cannot use this process. So usually we use the suffix. Remember, when we talk about medical terms, we start reading the medical term from the suffix backwards. That's what we have to do. Now, if you said bone disease or disease of the bone, if it sounds good to you, that's normal. You have a bone disease. Oh, your bone is disease. Doesn't sound too good, right? Bone disease is better than your bone has a disease. So you need to know how to play with these terms so the person can get a better understanding, whoever you're talking to. That's why we go over every single term and we divide it in its parts, and then we try to define, give the definition, a definition that is the most accurate, if you will. Iris, the suffix, phalange, remember these are the bones of the fingers. So usually we said fingers, but that's how it works, even though if it is the bones of the fingers, the phalanges. Inflammation of the fingers, but usually it's inflammation of the bone that makes up the fingers. So that's basically what it is. Okay, so phalanges or phalange were root, and iris is the suffix. Inflammation of the phalanges or the bones of the fingers. If you find like fingers, phalanges, it's correct, because that's what actually means. But in order for us to make a more specific statement, we usually, because it's not the fingers per se that they are swollen, it is the bones, because we're talking about the musculoskeletal, but in this situation, it's the bones. Okay, moving on. Any questions about these terms? Let's move on. Remember that I mentioned that I was going to talk about the hip bones or bones of the hip. Here they are. This is the ilium. Remember ili? These are these ear-shaped bones. These are the ilium. Of course, these are divided also. It has a little part right there that we come on. But mostly this part that looks like ears, this part that looks like ears is the ilium. And we feel it right on our hips. If we kind of palpate the size of the hips by the belly line, we're going to find these bones on each side. So these are the hip bones, all of them. This will be the ilium, particularly this top part. Then we're going to find below that, we're going to find the pubic bone, which makes the pubis, which is this part of the bone. This curve right here. This will be the pubis, one on each side. This is the pubic bone. Now another bone that we have right here, let's put it in a different color. This is the ischium or ischium. It doesn't matter how you pronounce, it can be pronounced either or. The ischium, this one that has a little hole in between. So this bone right here is the ischium. This bone that is right here in the middle, this is the pubic symphysis, which is right here. This is like a cartilage that holds this bone, this ischium, with this ischium. This is very important for females when they are pregnant. When they are delivering the baby, because the baby is here, when they delivering the baby, this stretches because it's cartilage. Stretches so the baby can come out through this side. Because remember, the reproductive system of the females and males is found right here in the pelvic area. And these are the structures that are protected by the hip bones. Okay. Now this will be the hip bones. These bones that are right there in the center on the top part, they are not hip bones. These are the spinal column bones. This is called the sacrum. This is a vertebrae. This is the coccyx. So this is the tailbone. This is the last little bone. Looks like a little tail from the vertebrae, the column vertebrae. So this last part of the vertebrae that comes here, this is the vertebrae that goes all the way to the neck. These bones are attached to the last part of this one. And this last bone, the sacrum, served as a support for the hips. See? They have an articulation right here, but it's a close articulation. So it supports the hips. So that's basically what it is with these bones. The hips of the males are narrower. The hips of the females are broader. So this is a female's hip. How do I know that? Because it's very wide. The hips of the males will be narrow, like this. Oh, wait a minute. I thought that I cleaned this. The hips of the males will be very narrow. Oops. Like this. Very narrow. It wouldn't be all this space. Why? Because males don't have babies. So it would be very narrow. Very narrow. Okay. So that's how we know that this is a male hips versus a female hips. So these bones will be more like this. This bone will be more like this, because it narrows on the sides as well. Okay. So we covered now the bones of the hips. Remember the ilium, the pubic bone. We have the ischium bones and the symphysis pubis. Those are the major bones of the hips. Let's move on to the vertebrae. See, we're going to have here the intervertebral disc right here. Let's use this highlighted. This is the cartilage. That is the disc that separates this bone on top and this vertebrae on the bottom. Every single vertebrae has a cartilage in between. Right here in the middle, the spinal cord passes through. So these are vertebrae. Disc is the cartilage. Not that changed the name. No, just because it looks like a disc. And when you have a condition that is called the herniated disc, means that this disc comes like this, outside. It kind of moves, slides. So this causes this nerve to be pinched, to be kind of squeezed, if you will. So then you have a lot of pain on your back, whatever else you have the pain, this impinged nerve. Remember, this is a dislocated disc. So what is it that you have to do? Go to the surgical doctor, the surgical orthopedics, and they move this back. They push it back. Now, the spinal cord is going to be right in the center, so it doesn't cause any pain or inflammation. So these are the vertebrae. Every single vertebrae is separated by cartilage. Remember, inter means in between. Inter, in between. Vertebra, vertebra. AL, pertaining to in between the vertebrae. Pertaining to in between the vertebrae. These are the vertebrae. These are the vertebrae, something that is in between. That's what it's talking about. So these images makes, well, I use these images so, you know, you can see what I'm talking about. What is the difference? What is it that we call these inter or per or hypo or hyper or sub, whatever else we need to know. This is the spinal column. Remember, spinal column is one thing. The spinal column is all these bones, all these vertebrae. all these vertebrae that we have here. See, vertebrae, all these are bony vertebrae, but in between them we have cartilage. The blue little part that you see in between the vertebrae, that's the cartilage. Why do we have a cartilage? Because the vertebrae moves. We have to flex them forward, move to the back, move to the side, stretch, try to reach something, we jump. So when we do all these movements, the cartilage protects these bones. Otherwise, they will break. They will collide against the other ones, and they will damage the spinal cord that goes right here in the middle. So that's basically what it is. We are not talking about all the spinal bones or anything like that, or the region. No, we're going to talk about these regions because we're going to apply them. This is the thoracic region or thoracic vertebrae. Oh, I'm sorry. This is the cephalic. What am I doing? This is the the cervical. This is the cervical vertebrae. This region is the thoracic vertebrae. This is the lumbar vertebrae, and this is the coccygeal vertebrae. So this is the coccygeal vertebrae. So we have 1, 2, 3, 4 regions. So the ones that we're going to talk about it are going to be this and this. Never mind. Oh, that this is this and this. I'm going to talk about the thoracic curvature abnormality and the lumbar normality, and then the entire spine. So if you look at the spine, this is a anterior view. When we look the spine with the person standing on the anatomical position, standing erect from the back, the spine looks like straight, but it's not straight. If you look laterally, see, we're going to see these curvatures. So these are different curvatures of the spine. So this is the cervical by the neck. This is the thoracic by the shoulders. And this is the lumbar right there by the abdominal area, but on the back. Once again, this is the coccygeal. But we are interested on this one and this one. Why? Because people present with deformities, abnormalities of the thoracic vertebrae and the lumbar vertebrae. And we're going to have names for those. We mentioned them already. We mentioned Kyph and Lord. So we're going to see how that plays out. I'm going to go to this picture. So we are going to talk about first kyphosis, then lordosis, and last we're going to talk about scoliosis. Why? Because it's important that you understand what's going on. So let's divide these words. Let's talk about kyphosis. Osis is the suffix, kyph is the word root. Osis is an abnormal condition of what? Of the thoracic. So right here, if you look at this patient, this person, this image, it has a hump right here on the thoracic. That hump protrudes right here on the patient's shoulder. So when you see someone walking like with the head down and he has this hump on the shoulder, on the back, that's called kyphosis. Lordosis, osis is the suffix. Lordo or Lord is the word root. So this is a inward, see, deformity of the spine and the lumbar area. This is by the abdominal area. So this is an outward deformation on kyphosis. So kyphosis, the spine goes out. So the curvature goes out. See, it's supposed to be right here, but then it goes out. It forms this hump. Lordosis, it goes inwards and produces this curvature. And if it goes indentated here, it's gonna show that this part of your pelvic area is gonna protrude, and it's gonna be looking, it's gonna make it look like you're pregnant, but you're not. That's a deformity of the spine, the lumbar region. That's what it's called lordo, lumbar, L. Kypho has nothing to do, but this is a Greek term, so it means thoracic, thorax. Now let's talk about scoliosis, because this is a very, it is most commonly known. Of course, this kyphosis is that you don't know the names, but we have and we see a lot of people with the hump in the back. So particularly the elderly. Why? Because this intercostal cartilage, it becomes very fragile, waste. So then the head, because the head weighs a little more, goes to the front, and this spine goes up. This is scoliosis. Now, scoliosis is the whole spine becomes twisted, like an S. This is like an letter S, you see? It's not supposed to be like an S, see? Starts right here straight, make a little curvature, then it goes right here, and then goes right here. Here is very pronounced. How do you know? Look at the shoulders. This shoulder is lower than this one. Look at this part of your chest, goes to the side. Here is indented. So usually when you stand up, when we do the physical exam, you're standing on the anatomical position, we're gonna see that one shoulder is higher than the other. So then we know already that is scoliosis. This is a deformity, a shape is the S, letter S shape deformity, abnormality of the spine. Goes all the way. It's not a particular area like kyphosis or lordosis. So here we have again the definitions. See, scoliosis, so it says Crockett, but we're not talking about Crockett Hillary or Crockett Kamala. No, we're kind of talking about curve. It's an abnormal curvature of condition of an abnormal curvature of, kyphosis, an abnormal condition, home. Kyph is a home, but where? The thoracic area. And here we have Lord. Okay, it says right here, bend forward. Now abnormality, but what is it that bend forward? The spine on the lumbar area. This is outside. So outward, inward. This is like an abnormality in the shape of the letter S. That's how we know. So if you see on your exam that you have an abnormal curvature of the spine, when one shoulder is higher than the other, you know that they're talking about scoliosis. If they tell you that the patient has a hump in the back, that is kyphosis. So that's how you are going to determine what condition the patient has. Okay, any questions? Let's talk about these terms. Now, these terms are terms that are not built from word parts. We are not dividing this in suffixes, prefixes, combining vowels, combining form, word roots. No, this is the whole name. We don't divide any of them. Even though if some of them we can divide it, we don't divide it. Tunnel, we cannot divide it. Syndrome, we cannot divide it. Carpal, we can divide it. But because it's the whole term, we don't divide any of them. Carpal tunnel syndrome. Remember, this is a condition where we have a little tunnel and the wrist of the patient. These are the fingers. Right here on this part of the carpals, there is a little tunnel right here with 3 nerves passed through. And these bones becomes very narrow. The space where the nerves passes through becomes very narrow. So because it becomes very narrow, this nerve swells up and causes pain. And you're not able to move the hand much. You're not able to hold things. You're not able to close your hand. So that's called the carpal tunnel syndrome. They had to do procedure, of course, to release these nerves. But carpal tunnel syndrome is a condition of the bones, remember. Okay, next we're gonna have fracture. What is fracture? Broken bone. So if the bone's broken in any form, because there are different types of fractures, so the only thing that we care is that there is a fracture right there and something has to be done. So fracture, we don't divide it. A broken bone, it doesn't matter how it's broken, may be completely broken, may be partially broken, may be impacted, may be a hairline fracture, it doesn't matter. It's a fracture. And we're talking about the bones, fractures, we do not divide this term. Gout. Gout is a medical condition that happens not to the bones. Well, it can affect the bones, but mostly is produced by excess of uric acid. So what happens is that mostly happens to the big toe. The big toe, right here, got swollen. It looks like a tomato or a hot potato. The person cannot wear shoes. Happens a lot, males, because of drinking. Alcohol causes gout, mostly on the big toe. It can happen to the knee. That's what we call gouty arthritis. But this is caused by the increase of lactic acid. Lactic acid. That's called gout. So gout cannot divide it. So if a patient comes to your office and has the big toe is huge, swollen, they didn't have no trauma, nothing fell over their toe or whatever, and they tell you, oh, that they always have inflammation of that, and it looks kind of red, like very bad, they have gout. Okay, so remember, it's caused by excess of uric acid. Red meats produce this, alcohol produce this. So if you are used to eat all the red meats, particularly raw steak, that is kind of bloody, all raw, then you will develop this condition. Okay. Herniated disc. I already explained it to you in the picture prior to this. Herniated disc is when the disc, this that is in between these vertebrae moves out. And because the spinal cord passes through it, now you're going to impinge the nerve right here. And it's going to irritate it. It's going to swell right here. And every time that you do a little movement, then this is going to be very painful. That's a herniated disc. Impinged nerve, that is also called impinged nerve. But herniated disc because it goes off the tracks. It's supposed to be here, the disc, but it moves outside. That is herniated disc. Can be fixed with a very minor surgical procedure. All right, let's talk about MRI. See, this is one of these imaging testing. This is MRI. MRI, magnetic resonance imaging. Magnetic resonance imaging. So usually the doctor don't tell you, it's not going to tell you, oh, can you please do a referral for this patient for a magnetic resonance imaging? No, send this patient for an MRI. Send a patient for a CAT scan. Send a patient for an X-rays. That's what they're going to tell you. Send a patient for a sonogram. So MRI, magnetic resonance imaging. So that's basically what it is. So you gotta get just familiar with these terms. These terms cannot be divided. We don't say, oh, imaging, we're gonna break it down in word parts, doesn't have. Resonance doesn't have. Magnetic, even though if it sounds like IC, we don't do it. Next, we're gonna use muscular dystrophy. This is called MD. Be careful with this acronym. This does not imply medical doctor. MD, muscular dystrophy, or macular degeneration, that is within the senses. So be careful with these terms. Depends on what is the content or the context of whatever you've been reading or the notes that you are writing down, then you need to use the appropriate acronym. Muscular dystrophy, what happened to the muscle? This, remember, means abnormal trophy development. So it means that this muscle is weak. This muscle is thin. This muscle is not strong. So therefore, if you have muscular dystrophy, you're not going to be able to move. Probably you're going to be in a wheelchair. Because your muscles are very weak. So we don't divide these terms. We don't find then what is the suffix, what is the prefix, what is the word root, so on and so forth. That will be muscular dystrophy. Here we have another one that says nuclear medicine. This is a test. I'm gonna send you to get a imaging report or exam that uses some type of nuclear protons, electrons, some type of chemicals. Not too common, but they just throw in there. Forget about that. That will never be asked. But orthopedics, you need to know what is orthopedics. Remember orthopedics. So pertaining to orthoempirics. This is the specialist, see, has to do pertaining, I'm sorry, pit and X. So this is pertaining to the articulations. Pertaining to the articulations. So that is basically what it means, orthopedics. When you are sent to the orthopedic doctor, that is called orthopedist. Right here, the next one. Orthopedics pertaining to orthopedist. That is the suffix, the specialist. Orthoempirics, once again, pertaining to the muscles and the bones. So this is the specialist of the muscles and the bones. That's basically what it means. So just know the profession. Remember that we don't divide these terms. I'm just giving you an idea, but this is the specialist of the bones and the muscles. This is pertaining to the bones and the muscles, but we don't divide them, not for these particular specialties. Osteoporosis. Now, osteoporosis, you can divide it, you can. But because it's a condition, usually, we just leave it like it is. Osis is the suffix. Osti and O, this is the combining vowel. This is a word root, por, and this is a word root. So this is an abnormal condition of the bones that have become weak, porous. You know what's porous? The little holes that we have on the skin where we, with sweat comes out. Those are called porous. So the bones becomes like very porous, like a sponge. That's called osteoporosis. What causes osteoporosis? Lack or deficiency calcium and vitamin D. So if you have osteoporosis, then the doctor is going to recommend you to take certain amount of calcium and vitamin D. Women are the most affected, more at risk. So please remember this. When you see osteoporosis, which is lack of calcium and vitamin D on the bones, they're going to ask you who suffered most of osteoporosis. So your answer should be women. Women. Yes, men suffer osteoporosis, but it's very, very minimum. Females suffers more. Why is that? Because females after menopause, they no longer produce estrogen. And estrogen is that hormone that helps to retain calcium and vitamin D. Since you're no longer producing it, you lose it. So your bones become very weak. And that's why females break their bones very easily. They suffer fractures very easily. And they suffer osteoporosis very easily. So remember, osteoporosis, females, women. Don't forget about that, just in case, we don't cover the chapter that contains this and anatomy and physiology, or you have covered it already, but nobody talk about it. So very important. Rheumatoid arthritis, remember we have osteoarthritis. We saw it before, osteoarthritis. Rheumatoid arthritis, this is another type of arthritis. We don't divide this. Arthritis can be divided, but rheumatoid, no. So we don't divide it because these are terms that are not made of that. So that's basically, they are not made of word parts. So rheumatoid arthritis is a different type of arthritis which comes with inflammation of the joints of the fingers. So when you see a finger, normally you have a finger and it ends up like this, right? Like your nail right here and your finger right here and your little bones, and this is your finger right there. Now, when you have rheumatoid arthritis, these joints, you're gonna have a bulging right here. So you're gonna have a bulging right here where you have the articulation of you have a bulging right here. You have a bulging right here on the articulation. So you're gonna see your finger like very deformed. You cannot put right here ring, a finger ring, you cannot use it because these big swollen nodules that you have on your, every joint of your fingers are not allowing anything to do, and you have a lot of pain. That's rheumatoid arthritis. Not only with the fingers, but with the toes. The hand goes like the chicken leg. You go kind of twisted. So instead of your hand be like this, it's gonna look like this. Instead of being like straight up, like this, your hand is gonna be twisted to one side, and your feet is gonna be twisted to one side as well. Looks very weird. So that's rheumatoid arthritis. If you see someone with the hands like a chicken leg, chicken fingers, then you're gonna know that this person has a type of arthritis, but it's called rheumatoid arthritis. Very bad. Okay. Let's talk about these abbreviations and acronyms, because they are very, very important for us to know. So let's start with C1 to C7. So C stands for cervical. These are the cervical vertebrae. Remember, the cervical vertebrae are the vertebrae on the patient's neck. So we start with C1 to C7. There are 7 vertebrae in the neck, the cervical region. Remember, this means CAT scan. CAT scan, CTS. FX means fracture. L1 to L5, L is lumbar. These are the lumbar region vertebrae. There are 5 of them. 5 vertebrae, L1, L2, L3, L4, L5. The cervical, S1, S2, S3, S4, S5, S6, S7. MRI, remember the magnetic resonance imaging. MD, muscular dystrophy. This is the nuclear medicine, remember? OA, osteoarthritis. This is orthopedics, rheumatoid arthritis. These are the thoracic vertebrae, T1 to T12. So we have 12 thoracic vertebrae, 5 lumbar vertebrae, and 7 cervical vertebrae. So that's basically what it is. So remember, the cervical ones are the ones in the neck. The thoracic are the ones on the shoulder, on the back. And the lumbar are the one, remember, by the abdominal area on the back, or the belly on the back. Any questions? Okay, moving on. Oops, right now, pretest. Slow movement. So let's remind this slow movement. So there are 1 and 2 dots. So which one means slow movement? You can pick either or, slow or movement. If you remember one of those, you have the answer to the question. A, B, or C. Anyone? Okay. Let's see a couple of more. Okay. So let's go here again. So slow movement. So if you don't remember one of them, you might remember the other one. Brady means slow. We didn't talk about this. And logi is a totally different issue. So Brady is the right one. Brady kinesia. Kinesia means movement. Brady means slow. Remember, if you remember other classes like EKG, bradycardia, slow heart rate. So very important. Bradykinesia, small movement, like patients with Parkinson's disease. They suffer bradykinesia because they kind of not able to move normally. They walk very slowly and they kind of drag the feet on the floor. They don't lift the feet to move and go and give the next step just like normal people do. So bradykinesia, that will be the correct answer. Very well. Okay, let's go next, number 2. Disease of the muscles not associated with the nervous system. So disease of the muscle. Let's see who get it right. A, B, or C. Okay, base your answers on disease. So we always pick one. Check first all the words. And if you see that that word has the same word root, go for the suffix. And if the suffix has the same one, then pick the word root. That's how you have to do it. All right. So
this I don't know.
it's all right. Let's go back and explain. Okay, so it says right here, disease of the muscles not related to the nervous system. Don't worry about all this wording, because what we worry is about, oh, not associated with the nervous system. Who cares about that? This says disease of the muscle. This is all I have to understand. Plastic, that's surgical repair. Algia, that is pain. Patty, oh, disease. Disease. And myo means muscle. Disease of the muscle. See, when you read the questions, don't get kind of put away or taken away from all the information they give you. These are distractors. These are associated words that they're going to put there just to see if you understand the question or not. But it says right here, disease of the muscle. That's the only thing that I care about it. Disease, oh, patty, muscle, myo. Ah, that's it. Because none of the other ones have disease. So the only one that has disease is this one. So go by the definitions of the suffix or the word roots. The rest, do not worry about that part, okay?
Okay.
So better now? So you feel more confident now?
I understand.
Yeah. You just, this is a process of, learning. You're not going to get it at once, little by little. But if it says disease of the muscle, I will stop right there because everything else is not telling me anything. That's distracting me. So disease, patty, muscle, myalgia, muscle pain, tenoplastic, that is a surgical repair of the tendons. So it has nothing to do with muscle disease. So if you know one of these, you will get it right because myo, oh, I have myo. And then patty, but I have myalgia, myopathy. So go for each one of the terms that is going to be easy for you to remember. Otherwise, number 3, without development. It's going to be a little tricky, but try A, B, or C. Without means no development. Which one of these means or the definition is no or without development? A, B, or C? Try, do your best. Okay. Giving a couple of seconds more to see who else wants to try. Okay. So development. There is 2 words that mean, all of them has development. Trophy, trophy, trophy. But here it says that is hyperdevelopment. It developed too much. So this is not the one. Here it says this. They have an abnormal development. This is not. A means no without. A, no without. So atrophy will be the correct answer because A means no or without. Trophy means development, meaning that this muscle has not developed properly. A, no. Without means the same. Trophy means development. So this muscle or whatever it is did not develop correctly. This didn't develop at all. That is called atrophy. It didn't develop. Without development, no development. So sometimes we have to kind of answer the questions that we might think, or we are kind of know that that is not. If you see hyper doesn't mean without or no. This doesn't mean without or no. So I use the process of elimination to understand this. Now, do not worry because we just learning all this. So this is not going to be like easy to go and get it because you are getting used to these terms, particularly when you said without. If I put no development, it will be the same because these two terms are difficult, trophy and putting a trophy together. So no worries. Just try to remember because we are still in the process of learning. Let's go to number 4, hernia of the EQ. So pay attention to the wording, hernia to the EQ. So probably we haven't seen some of them, but pay attention to the wording. Which one give you most of the information? So think about it, A, B, or C. Okay. All right. So give you a couple of seconds for you to decide whether you want to give it a try. So let's talk about hernia. Probably we haven't seen this term before, but we have seen EQ. So here we have EQ, we have EQ, we have iliac, but iliac doesn't have anything to do with EQ. So that is not the right answer. So C is not. So now I have 2 EQs. But now I said EQ pubic. You know that this is a bone, this is a bone, the pubic bone, the EQ bone, because we already discussed those. So this is not the right answer. EQ seal means hernia. Seal means hernia. EQ means the bone in the hip. So this is the bone that it is herniated. So once again, it wasn't easy because some of the terms are very complicated to remember. We just saw them, yes, but these names are not easy to stick in our brains. We can even barely pronounce that. EQ, seal, EQ cell. So that means herniated bone of the hip. Now, are you going to have these questions on your exam? No. But we are covering the chapter, so we try to give you some of the parts of the medical terminology so to see if we can kind of go with. Suture of a tendon. Now, here goes again. Suture, tendon. So try to guess which one is it. You know one of them that is not. So you go for the 2 of them. A, B, or C. Try to guess if you're not sure. Give your best try. No.
Why? 为什么是4？
Don't worry. Don't sweat it. Don't kill yourself. Don't stress yourself. Try to do your best guess. Remember, use what you already know. And then by process of elimination, you start kind of moving things around. Okay, let's try to help you out with this. Let's go for the things that we know. Tendon, teno, teno, teno. Oh, I can do nothing about that because teno, 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 all of them have the tendon. But pay attention to this. This says tendinitis. Oh, wait a minute. This is inflammation of the tendon. They're not asking me about inflammation. They're asking me about suture. Tenodesis. This is a fixation. We are fixing, we are putting it, we are fusing two bones together, or two tendons together. We cut it off the tendon, we are putting it together. So this is not the right answer. So tenorrhaphy, raphy means sutures. Raphy means to suture something. So tenorrhaphy is suturing the tendons. The tendons got cut off. So now we're putting it together through sutures. We're going to put stitches. Sutures means stitches. So that's basically what it is. So these are a little harder terms. So no worries. These are not actually questions that will come out on test. So just for you to know, so you can think about a little more when you are answering some of the questions. So just if you're not familiar with some of the words or the terms that you see there, try to do it by the process of elimination, just how we did right here. Check first the first part, the second part. Oh,
姐，9点开个会，估计半个小时也能完事儿。然后9点半或者9点半多点这完事儿就给你通话。
Okay. Be careful with the microphone. Turn it off.
Sorry, teacher.
That's all right. I didn't understand anything anyways, but you know, it can cause a little interruption. So no worries. Okay, so little by little, you know, you're gonna be learning some of those terms that are more commonly used. So don't stress out because you didn't get it right the first time, the second time, or whatever time this happens. This is not something that you're gonna learn overnight. Just for me covering this does not imply that, you know, that you master this. No, it's gonna take some time. It's gonna take practice. I can tell you that much. It took me time to learn most of these medical terms. Well, I've been doing this for over 30 years, so well, that would be kind of embarrassed to say that you don't know it, right? But you just started seeing it now. How am I gonna expect that you're gonna know all these by heart? No, you're gonna learn some of them. Some of them are gonna be easier than others. So, but that's good enough. Remember, if you learn kind of 10% of the lectures for each chapter, that's gonna be good enough. You don't have to know 100%. That's impossible. Just for you to get to know that these medical terms have parts, and you have to go through all these parts, define those parts, and then you have the complete definition or meaning of what medical terms means. What is it that they're talking about when we write a medical term? That's what I want you to remember. Okay. All right. So we're gonna leave it right here. So it is 9 o'clock. We are gonna call it a day. Remember, there is no class tomorrow. Fridays, no class. Monday to Thursday. So enjoy your weekend. Thank you so much for participating on attending the class. I will be seeing you guys back on Monday. All right. So have a nice weekend. Enjoy it.
Good night.
Have some fun. Relax from all this. Don't go there and start reading all these terms during the weekend. It was enough with having them all the week, right? So just relax a little bit. Take it easy with you. Bye. Take care.
Teacher.
Good night.